Longview orthopedic surgeon gets FDA approval for a unique technique to treat low back pain and more specifically sacroiliac joint dysfunction. It's also minimally invasive and was first performed at Longview Regional Medical Center. Dr. Babajide Ogunsinde, a Harvard-trained orthopedic spine surgeon, joins us now. Thanks so much for being with us.
Thanks for having me.
So, Dr. Ogunsinde, this is being called a cutting-edge treatment for East Texas patients. Can you talk a little bit about that?
Yes, absolutely. Again, thanks for having me. So this procedure is called a posterior medial to lateral trajectory approach for sacroiliac joint fusion purposes. There are many other techniques that have been published in the spine literature about sacroiliac fusion, and those involve multiple incisions, longer surgeries. They're more painful. Patients have weight-bearing restrictions for about a month to 6 weeks, and it involves a longer procedure and more blood loss. So this procedure that we started at Longview Regional was inspired by looking for a way to reduce those factors: the pain, the bleeding, the multiple incisions. So we devised the technique where we make a single incision just below like the L5, S1 level, which is at the waistline. We make it in the midline, and then we aim from that incision. We can address both SI fusions with a 1.5 to 2 centimeter incision, and by doing this, we can put 2 to 3 implants across the SI joint, which is the sacroiliac joint, without having to switch sides, minimal blood loss. There's no restrictions in terms of weight-bearing status. And when we devise this technique, you have to go through a process. That process involves getting this approved with the FDA. And once we had that done, we were happy to present this to the public.
So I think most of us probably don't know about our sacroiliac joint until we start having a problem, and then you start hearing about that SI joint dysfunction a lot. Maybe as we get older, or those who are like really active. Can you tell me a little bit about who this procedure is for?
Yes. So I'll tell you about sacroiliac joint dysfunction. So it's we have known risk factors for sacroiliac joint dysfunction. A few of them are women, patients with high BMI, over 35, so slightly overweight. We have patients that have had multiple children, and also post-traumatic. So we have patients that have had trauma to the pelvis, trauma to the SI joint, and by doing that, it stimulates arthritis of the SI joint. And those patients present with back pain, and they have a normal MRI of their back. So typically about 30% of patients that have back pain have SI joint pain. So 10, 15 years ago, when we didn't know anything about SI joint dysfunction, we just thought these patients were not being honest, or we felt like they had some psychosomatic problems. But now that we know that SI joint is a problem, especially for low back pain, when you see a patient with a normal MRI and physical exam that correlates with SI joint dysfunction, we definitely go after that, and we've had so much success with identifying this and treating this either non-surgically and surgically.
So is this a day surgery, or do you have to spend the night in the hospital?
Okay, good question. So this is a day surgery. Again, I always joke with the patients. I say, this surgery you can have done and stop by a restaurant to have lunch on your way home, because your length of anesthesia is only about 20, 25 minutes for the surgery. You spend about 30 minutes in recovery, and then they discharge you home. Typically, I would discharge patients home on oral pain medication. There's no restrictions in terms of ADLs. They can shower, they can drive in about 1 or 2 days if they're off the pain medication. So the restrictions, the pain is less. We don't have any restrictions for this surgery. We've had patients within 2-3 days sending us emails about how great they feel after the surgery.
Thank you so much, Dr. Ogunsinde. Now, to stream the full interview on Dr. Ogunsinde's FDA-approved procedure, just head over to CBS19.tv and CBS 19 Plus. We'll put that on there for you.